With the local elections in England coming, the Conservatives have an announcement today about reducing the amount of admin and red tape the police have to deal with. Chris Philp is the Minister for Crime and Policing. Good morning.
Good morning, Michelle.
Could we begin, though, with the doctors' strike, because we are in day 3 and there is evidence from patients and indeed from NHS leaders about the increasing challenge that the strike is presenting. Are you prepared to sit down with ACAS, as the BMA is?
Well, we're absolutely prepared to sit down and negotiate reasonably, as we did in relation to the ambulance paramedics and the nurses, where just a few weeks ago we had constructive discussions with the relevant trade unions and an offer was made, which is now being put to the members of those unions for hopefully approval. So the government has a clear track record of negotiating in a reasonable and conciliatory way with health sector workers, as we've seen from the ambulance and the nurse example.
Is that a yes to ACAS?
Well, I think what the health ministers have said is that if the Junior Doctors Committee is willing to suspend their strike action and remove this 35% pay increase as a precondition for talks, then we're very happy. The door is open to have those talks, and we'd strongly encourage that to happen.
It doesn't seem we're any further along, and yet the BMA have made a shift, haven't they? They're not talking about the 35% as much as they are talking about a credible offer. They have said, we're ready to sit down with ACAS. ACAS say they're ready. They just need all the parties, and that means the government. Why not just say yes in a strike where lives are at stake? That's not the case in every strike, but it is in this one. Yes to ACAS. It's not something that involves you having to agree anything. It's a process. It's a discussion.
Well, that is a very recent change in position. That wasn't the BMA Junior Doctors Committee's position until very, very recently. I think it would also be constructive if they would just suspend the strikes while talks take place. And if they're willing to do that, then I think the Secretary of State's door is very much open. And we demonstrated, we took exactly that approach with the relevant trade unions in relation to ambulance paramedics and nurses. A reasonable offer was made that is now being balloted on. So there's a very clear way of getting this resolved that we used just a few weeks ago. And we'd encourage the BMA Junior Doctors Committee to follow the same process, because that door is open.
They've shifted, as you have acknowledged. There's been a different stance from them as of yesterday. ACAS are ready. Why can't you just say yes to talking to them in that setting?
Well, I think if they obviously I'm not the health secretary. If they put that suggestion to the health secretary directly and express a willingness and a willingness to suspend the extremely damaging strike action that some hospital leaders say is putting patient safety at risk, then the Secretary of State's door is open. So I would urge them to make formal contact, not through the media, but directly with the Secretary of State to put their proposal to the Secretary of State. But I would suggest that should include suspending the current strike action while talks take place.
Your announcement about policing, talking about